Thank you for joining us. Today I have Dr. Mark Stein, who is a radiologist for Radnet, and today we're going to be talking about calcium scoring. Well, thank you for being with us.
It's my pleasure. Thank you. Thank you for asking.
We know you're an expert in this field, and so we wanted you to tell us a little bit about, first of all, what is calcium scoring?
Calcium scoring is a test where you use a CAT scanner to determine how much calcium deposits there are in the arteries to the heart.
Okay.
Which can give you an idea of how much vascular disease or coronary artery disease a person has.
Okay, okay. And at what point would you actually use the calcium scoring?
It is not a screening test for heart disease. It's a test that we use to determine and help us determine the risk of a patient having a cardiovascular event, particularly in patients who have a high cholesterol.
Okay.
And it's used as a decision maker to help decide whether you should put a patient onto cholesterol lowering drugs or statins.
Okay. So I want to talk to you about something. My mother actually had calcium in her arteries and they had to go in and take it out. So at what point would she have gotten tested?
Well, you don't really take out the calcium in the arteries. The calcium is an indication that there is vascular disease.
Okay.
It's not an indication that you're going to have an imminent heart attack.
Okay.
And a lot of people have calcium. As you get older, you tend to get calcium in your coronary arteries. In fact, it's more common to have some than not to have any when you reach the age of 70 or older.
Oh, okay.
So it's an indicator that there is vascular disease. It doesn't necessarily mean on its own that you're about to have a heart attack.
So what would they do with the calcium that's in the arteries?
Nothing.
Oh, they don't do anything. Okay.
There's no problem, in fact, with the calcium in the arteries, and the calcium that we see is not usually the calcium that causes a problem. The calcium that causes a problem is the disease that causes the problem is really a plaque that is not calcified.
I see.
And we don't see that on the routine calcium screening. We can see that with other tests, but not with routine calcium screening.
Okay.
All it is that there is an indication that there is vascular disease.
Okay, gotcha. And how is this test performed? And is it dangerous?
It's not dangerous, but there are some things you need to be aware of.
Okay.
It's not dangerous in the immediate having the test, but there is some radiation involved with it.
Okay.
The amount of radiation is about what we call 1 millisievert. It's not very high. It's not something that would stop you from doing the test, but it's not a test that you would do every week, for example.
Right.
The other disadvantage of it is sometimes you see things that you don't really want to see. So you may see a small lung nodule that really isn't a problem, but may cause a workup later on. However, having said that, I've picked up lung cancers when I've done these tests.
Okay.
So there are pros and cons to it, but you need to be aware that occasionally you may have an unnecessary workup just because we found a small nodule that wasn't doing anything.
Okay. And at what point do you actually do the calcium scoring test?
We do the scoring test in patients who have a high cholesterol or have risk factors for coronary artery disease, where the physician is unsure whether to treat the patient with cholesterol lowering drugs or not.
Okay.
If you have a very high risk of coronary artery disease, you're a diabetic or a very strong family history or a cholesterol greater than 190 milligrams percent, that's an indication to treat without doing a calcium score. If you have a lower cholesterol and the physician is unsure, you may have a reason not to treat with lower cholesterol lowering agents, then the test is useful. If you have a negative test, then they may elect not to treat you and take the risk of the treatment.
Okay.
If your calcium score is higher, then they may elect to treat you, even though there may be some risks from the treatment itself.
So tell me what the risk factors are associated with this.
The risk factors for coronary artery disease are many. The main ones are diabetes, high blood cholesterol, a family history of heart disease, and there are some other causes, some lesser causes, obesity, things like HIV/AIDS, patients with autoimmune diseases. All of these patients are predisposed to getting coronary artery disease. The use of calcium scoring in these patients is for those patients in whom the major risk factors are not present, but they have a high cholesterol, but not high enough that they fall into the very high risk group. Your physician will stratify you as to whether you have a high risk of coronary artery disease, an intermediate risk of coronary artery disease, a borderline risk, or a low risk. The use of calcium scoring is particularly in those patients who have a borderline or intermediate risk of heart disease, who have some other risk factors such as HIV/AIDS, autoimmune diseases, obesity, and some other of the risk factors that your physician will know about.
Are those things that build up over time? For instance, some people smoke all their life and they may or may not have this issue, and some people maybe smoke 5-10 years and they do have the issue. Is there a time factor?
No, there's no time factor. I think a lot of it is genetic.
Okay.
Some people are predisposed to it, but smoking is probably one of the highest risk factors that is preventable.
Okay.
And in fact, what we found is the amount of peripheral vascular disease and heart disease is lower in areas who have stopped smoking than in areas, for example, in the Midwest where there is a lot of smoking.
Okay, all right. And then the example that I had given you earlier regarding my mother, what did they do exactly to her arteries?
What they probably did is they did a diagnostic procedure to see whether there were any narrowings associated with the calcium. If there were narrowings in the coronary arteries, they will dilate those.
Okay.
They do not remove the calcium that's there. You would have to remove the entire vessel.
Now I understand that this calcium scoring test has now moved kind of higher in the rankings of whether you do it or not. Tell me about how that comes about.
The latest American College of Cardiology and American Heart Association guidelines that were published in about November of last year basically have raised calcium scoring to a level higher than some of the other tests we used to do to determine whether to treat patients. So we used to use C-reactive protein, some other tests, and calcium scoring was lower down. We have now realized that calcium scoring is an easy test to do. It's very reproducible, and it is useful to do now in those patients who are at risk for coronary artery disease, but you're not sure whether to treat.
Okay, and then once you have the test results back, and it does show traces of calcium buildup, is at that point is when you prescribe the medication, or what else would you do?
So basically what your physician will do is he or she will decide what your risk of a cardiovascular event is.
Okay.
Depending on that risk, he will order or she will order the calcium scoring. When they get that result back, they will put it together with all your other risk factors and decide whether you need to be treated for your high cholesterol or not.
Okay. And is there a way to prevent and possibly reverse calcium buildup in the arteries?
There is some work that says that the statin drugs that we use, the cholesterol lowering drugs, does reverse the calcium buildup. More important is it can lower the risk of a cardiovascular event. As I've said before, the calcium itself is not the calcium we're worried about for causing a cardiac event.
Right.
What we're worried about is the plaque that we don't see.
Okay.
And so that is where it's really useful. You can reduce the calcium score with statins, and in occasional people you can actually increase the score with calcium, with cholesterol lowering agents. So long-term lowering the calcium is not as important as using this to decide when to treat a patient for high cholesterol.
And then what exactly causes the calcium buildup? I mean, for me, you might think, well, maybe I'm drinking something that has calcium. Like, what if I drink too much milk? Is something like that even possible?
No.
Okay.
Really, what we're looking at is atheroma, vascular disease that occurs normally with age in most people.
All right. Good. Okay, good. And then how often should someone have this test?
That is very controversial. And in fact, I'm not sure that once it's done, whether you would have it again unless the patient had a score of 0. If the patient had a score of 0 and was not treated, then you may want to do the calcium score a year or 2 years down the line to see whether calcium is now developing, and a patient who you decided not to treat would be treated in the future.
Okay. And then here in Laguna Woods, where can they go to get this kind of testing?
We have a site right in Laguna Hills at Saddleback Valley Radiology.
Okay.
And we do a number of them there. We probably do 3 or 4 a day.
Okay.
And Radnet has a number of other sites that does calcium scoring. And you can go onto the Radnet website and see where they are.
Okay, but again, this would be something that would be ordered by their doctor, having them know that that's where they need to go.
Yes, we
Okay.
would. This is not a screening test. This is a test that is of value to decide when to treat a patient. Because if you have somebody who's got no symptoms, is very low risk, and suddenly you find calcium in their coronaries, you're not going to do anything with that result.
Right.
So before you order a test, and this goes for all radiology tests, I recommend you know what you're going to do with the result before you do the test rather than after you do the test.
Okay, all right, perfect. Well, thank you very much. Is there anything else that I might have missed?
No, I don't think so.
All right.
Thank you for inviting me.
You're welcome. Thank you for your time. And thank you for joining us.